My name's Cassie Kleppel. It's my last semester. Today is January 29th, and this is my chest tube video. Knock, knock, knock. Hi, Mrs. Jones. How are you doing today? Good. Awesome. Can you tell me your name and date of birth? Perfect. All right, so today I'm kind of just going to do some teaching. So as you know, you have a tumor within your lungs, and it's creating a lot of accumulation and secretions with fluid within your pleural space. So the doctor has ordered a chest tube. We have looked at your x-rays and we can see all the fluid within that space. So we're going to put the chest tube in, and I'm just going to kind of teach you about the procedure and then what to expect afterwards, okay? And let me know if you have any questions. So to begin, we will administer some medications just to kind of ease the discomfort during the procedure because he will be awake. He will make a small incision within your chest wall, and then he will insert a chest tube that's about this big. It has a trocar within it, but that trocar will come out and the catheter will stay in place. After it is in place, I brought in an example of what the chest tube will look like. So this is what it will be inside of your lung, and then we have this long tube that goes into this collection device. So he will usually suture this into place, and then we will put an airtight seal around the dressing just to make sure it stays secure and we don't have any air leaks, okay? So then, I want to teach you kind of just what all is going into this. So after you get the drainage coming from, it will go into this first collection chamber so we can see how much is coming out of your pleural space. And then we're going to be measuring this every shift and making note of that on this with some Sharpie or something with our initials. Our second chamber is the water seal. So we normally keep this at 2 centimeters, and you can we'll see the line for that. Also, something important with this, if you see any bubbling, that commonly means that there is an air leak somewhere within the system, so we will need to check that out, but we will be checking that every shift as well. Another thing with this chamber, you might see what we call tidling, which is where the water kind of looks like a wave and it's just going back and forth, which basically represents you inhaling and exhaling. So that's normal. Usually when the tidling goes away, that means your lung is re-expanding on itself, and that's a good sign. And lastly, we have the suction chamber. Sometimes it's hooked up to suction, sometimes it's not, but that'll be up to the doctor, but that is where that is at. So then basically, after it's placed, we're just gonna be doing a lot of respiratory assessments. We'll be listening to your breath sounds. I will be checking around the site for like a subacute emphysema, which is kind of just like a crackling within the skin because air is trapped. So we'll just be doing a bunch of assessments on that. Also, we want to make sure that this stays upright. We don't want it falling. So if you do get up to go to the bathroom, just let us know, hit your call light. We want this to stay below your chest. So anything you need to get up for, we want you to be comfortable, but we also want to help you make sure the whole system stays intact. Normally, these will stay in place for about 2 to 3 days, just depending on the person and how much secretions you're putting out into the system. We'll look at x-rays and see how your progress, and once we feel like enough fluid has come out, we will usually remove that. The doctor will remove it, and then we'll put another airtight seal dressing for that as well. And then after we do get rid of this, we will put this in a red biohazard bag and put it in the biohazard waste. So I think I've hit all my points. Do you have any questions for me before we start the procedure? All right, well, the doctor and us will be back in to get that started, okay?